Good morning, everybody. Thank you for being here at the emergency meeting of the LaSalle County Commissioners Court. It's June 29, 2020. It's 10:08 a.m. We're at the district courtroom at the LaSalle County Courthouse, 101 Courthouse Square, Texas, 78014. We have full quorum. Mr. Noel Neves, Jack Alba, Rafa Ramirez, Mr. Raul Ayala, and myself are quorum. The bride say the pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
We have a public comment section. I'm not sure if anybody has any public comments to make, but we will allow you to do so. There continue to be changes pretty much weekly from the governor's office on the requirements that are being imposed on the citizens of LaSalle County. Chief Mendes, maybe you can give us an update.
Part of those changes that went into effect starting last Friday, as far as prior to that, the governor was reopening in phases. Last Friday at noon, all bars were closed, effective immediately. And then as of this morning, capacity at restaurants are back down to 50% instead of the 75%. The governor also put out no more any gatherings of 100 or less, so no more gatherings of over 100. But then he did leave it in the local jurisdiction's hands to limit down to a lot of jurisdictions have gone back to no more than 10 people in a group, and mandating businesses requiring face masks inside their respective business. Here locally, as of this morning, we have 10 cases here in LaSalle County. 4 are listed as recovered, 6 active. Later on today, we'll be adding another active case here in LaSalle County. I got notified last night. And also, we did have a resident here in LaSalle County did pass away this weekend from COVID. He did have underlying conditions, but it's still the effects of COVID. So we definitely have our first fatality here locally now.
One of the or some of the issues that we're looking at is that people announce on social media that they're positive, and when they do, we start getting a number of calls to our fire department, to our elected officials, PCD people at stores, at bars, out. We get calls from their parents, and we found out of some people being seen, but it's very hard to take their right away unless we have specific. One is HIPAA, but once they put it on HIPAA, they've already announced to the public that they are sick. 2 is there's 2 jurisdictions that can do mandatory quarantine on these people. That'd be the district attorney or the state. And we reached out to both the district attorney and the state. And in one individual, we ran the name and the birth date, and they couldn't find that person on the database. So it could be 2 things. They're not positive, or it could be positive, but the laboratory or the doctor had not reported the results yet to the state, which makes it, very difficult to do so. And we had asked Dr. Ross, which is the doctor from the fire department, to reach out to the local doctors and make sure that they're complying with the reporting requirements. What's been very hard is that the skip tracing, the tracing, contact tracing that is done by the state, they're running several days behind. So if somebody states they're positive and they've seen them, one is those people, when they do the contact tracing, have to be very honest and let those doctors know where they've been, or medical personnel where they've been. Otherwise, it's going to be very hard to contain. The sheriff was helping us with reaching out to Audrey and PABC. I asked them to see what they could do with PABC, but then the governor came back and has closed the bars. There is an option that we can to expedite contract is appoint our own medical director for this. And some other cities did, because then locally you can do contact tracing with the sheriff's office or the fire department or assign medical staff. But it continues to be that this is very serious, and there's a lot of risk, because Rio County has seen a spike in cases. I don't know what the number was, 106, 127.
It was over 120 on Friday evening.
So if you look at the stats on the Department of Health, they have the counties that are listed. At the very bottom, they have a thing called ICE. Those ICE are the Pearsall prisoners. It's like they also list the South County detention centers. We had 1 or 2 people over there.
1. No, 2.
2.
We're at 2.
And what happened in Ensenada is that the sheriff tested everybody, all the employees, all the inmates. So we had a baseline. Then the U.S. Marshal brought in a little pot of a group, about 10, but right away what they did is, at the facility, they put in a zero pressure room. The zero pressure room is a room that is not connected in circulation with everybody else, but the air goes out. So they put them in there, and these people had taken tests, but they didn't hold them back. The U.S. Marshal sent them even though they didn't have a result. So 2 of those were positive. Then another inmate got it, and then he tested all the workers again that were in contact with the person. It came out negative. So that's under control over there. Our small jail doesn't have zero pressure, so it's riskier. So if somebody has symptoms, it may be best to, unless it's a really hardcore crime, to not arrest them. For the time being, unless you have to. Unless you have to.
And just so everybody, I let the court know, we had a conference call last week with the state. Because of the mass positive cases in our region late in the past week, they are so far behind on the contact tracing. Saturday, one of our cases, I got an email from the state, one of our active cases, they barely notified us, and it was you have an active case, but they're recovered as of Monday. That's the wait time, about 14 days now. So it's very hard for us as the numbers increase on the state website and the citizens look at, there's 10, 11 cases. We've never been notified because they will not notify us until their investigation is complete. So it's very hard for us to ensure that these people are staying home. We get them what they need, keep people away, and the safety of everybody else if we're not notified on the front end. That's been a huge problem the last week.
We'll go back to Pearsall. You said it was 120 something, and in the prison it was 40 something. That's about 160 people total residing in Rio County, and we're sandwiched right in between. I'm hearing some construction workers that come out that were sick, that went back, and some of the employees that were working still have been tested. So those numbers of those people working in the area that are positive don't get reported unless how they get reported in web or wherever they're from. So there's more positive cases than we know in this community. and we have an opportunity to get some more testing. Now the tests are getting harder and harder to get. He reached out to the National Guard again to try to get a date. But as you know, they've been cutting, most states have been cutting back those services, but Governor Abbott has continued to promise that we're going to be able to get them. So chances are we're going to be able to get the National Guard, and also maybe another round with vitamin as well. I've had a lot of members from the community that y'all can handle it, y'all can take care of it, go ahead and try to control it, you know. So, but it, you know, this is what we want, and we need to push for that.
Our neighbors to the north, as of Friday evening, have 129 cases in Frio County.
You have a copy, look at the very bottom, and it says ICE.
Like at the jail in Encinal, once they do the test, what's the time frame that they get the results back?
It's usually 2 or 3 days, but as they get more tests, it's going to slow down. And it doesn't mean that the test takes a long time to get processed. You know, it can be done in a couple hours, but what happens is there's such a backlog in tests.
That's what
There's so many that's causing the delay. But it's been 2 to 3 days, the result.
We had a couple of firefighters that had to get tested, and it took 6 days to get the result. That's how backlogged the labs are right now. The numbers as of Friday for ICE are 17 active cases of ICE prisoners right now.
17 active.
Yes.
Half that amount.
And
LaSalle?
it does not show LaSalle Frio on Friday's report because they do a spreadsheet type of.
Okay. So those are recovered. What happens is that many of the employees from the facility in Senad, they come from Laredo, so, and so we got to urge our employees to practice social distance, wear their masks, even when they go home, you know, just practice that. We had at the elderly center, we had a person that went out of town, came in contact with someone that was positive. We had to work to be tested. They cut back on the food and should be giving the results this week. We opened the center, but we're saying for our residents too. I mean, you got to be careful. You start going to little groups, the parties, the beach, the river. Right now, it's not the time to do it. I mean, it's time to stay home a little bit longer. So the city imposed a mask at all the businesses, and then they're following the governor's order to close all the bars. They can do curbside, and I don't know what you think about the Maquinitas, but we're having people from out of town to come play those Maquinitas.
Yeah,
They're cool. Huh?
They're cool. I would recommend closing them just because
You
of
know,
the proximity.
if they're going to close the bars down, I'd recommend to go ahead and close those Maquinitas too. I mean, and it's hard to have the resources. And for the other businesses, we recommend, you know, wear your mask. I don't know, we want to get back to testing at the stores. I mean,
I think, of course, here at the courthouse, we should be, just like we have been, screening entering or anybody entering the building. But I'm going to say, as far as from the fire department side, our staffing, we're tired. We're hurting. So we can provide training to the stores on this is what to look for, the screening process, and then they can take over instead of.
And provide machines for
We can request more machines. We should be getting delivery from the state. They allocated more thermometers to every county. But we can do that to where they get the thermometer, we provide the training, and then they use their staff to handle the screenings. Of course, here at the courthouse, at the jail here in Cotulla, absolutely, we're going to be there. But we can train anybody how to take a temperature and what the signs and symptoms to look for.
You know, we had previously worked with the local government, with the local business owners in reference to capacity. Those numbers haven't changed, but what I've witnessed, people aren't shopping, it's hard, so I haven't seen that as an issue. Let's say leave that alone,
Yes, sir.
leave that alone.
how about them hair salons?
The government, he said, as long as they have social distancing, leave it open. You know, but they gotta wear their mask, everybody has to wear masks, gloves and everything else. Yes, sir, Mr. Myers?
I'd like to ask a question from a business. And our employee, OSHA has stronger regulations than anybody in the world on employees and on businesses of how we are to protect our business, our employees from anything, including our business the COVID-19. They have rules out already for COVID-19 and what we have to do as an independent business to protect our employees because we're alive. So I don't see where local governments or anybody else putting restrictions on us is going to help that situation because we're required. If anything, all an OSHA inspector come down and check the business. But one of the problems that I see is if you're not in business, we've got a lot of political entities putting burden on businesses, like you speak about the financials. They touch everything, they do more than the bars, yet they shut the bars down first. Okay, that's a problem. You know, and they're putting mom and pop businesses out of business. OSHA regulates them just like they do us. OSHA is not just construction. It's not just something else. It's all employers, period. The only ones they can't regulate is government entities. A city can put their employee at total 100% risk in an uninsured home, and if he gets killed, nothing happens other than they can sue us. But OSHA, on me, on the other hand, when I was in environmental cleanup and doing our underground facilities and digging big pits, I had requirements I had to meet on everything. I do the same thing in the hardware business that we have in chemicals. One of the things I haven't heard anybody say anything about is how much oxygen does the map restrict on when we're wearing this type of mask? And why does just any mask work? I can use this piece of t-shirt here that was a mask. Actually, we ordered them in and got them. But you can see, I can see you through this. What protection is that? This is more protection than anything because it has to go out and around. And I can see it. When we get the mandated stuff that we're going to mandate, we need to mandate, okay, you have to wear a full respirator. But yet if I wear a full respirator, every so often I have to have a break because of OSHA, not because of local business or because of that. I have to allow my employees certain breaks so that they can come back to their natural state. Okay, get enough oxygen. All the alcohol, when I was doing environmental cleanup, that we're soaking up to our liver as we continually use hand sanitizers, it's affecting our body inside. If we're absorbing it straight in, it's going to that. I think what's happened in the world today is we've gone to pandemic instead of logic. And we need to logically think about what we're mandating everything. I have to do the same thing with my employees. I'm not afraid. I'm gonna be 60 this year. I'm afraid of it getting me, me dying from it. And as an American and as a constitutional right, I feel like that's my choice. Because somebody can decide to go kill their baby before it's born, and they have that right, but I don't have a right to choose without wearing a mask. That's a real problem for me when we get into the government side. Okay, we're now picking and choosing what we're gonna mandate and what we don't. That mask actually, ultimately, if you think about it, and OSHA has a requirement because the politicians have put pressure on them, sure. It protects you from me, not me from you. Everybody says, well, I'm wearing it to protect you. Everything you breathe out, you've got to get rid of that carbon dioxide. You've got to get rid of all those things that are in your body that are hurting you. And so it's legal. Even a self-contained breathing apparatus, we used to do confined space entry. Everything that goes out of that stupid gear, what's coming out of your body. So that virus is part of it. It's going to leave. It's not going to stay in there. So the mask is protecting me from you when I wear it. But if you're wearing it, it's not protecting me. Maybe in a finite way, but not in a complete way. So my deal is what we have government entities that are already controlling our businesses, our construction. Really, everybody's under OSHA. Why don't we just let them do their thing? And that's my concern. Because the more we put on businesses, when businesses are done, there's going to be no money for them. There's going to be no taxes. There's going to be nothing. We eventually put all the mom and pops out of business. Want to talk about the oil field being a crunch? Wait till there's no sales tax. Wait till there's no income tax because there's no employees. We're going to have problems. It's going to do away with it. Because the government doesn't make money, they take money. They take money from the businesses, they take money from the landowners, they take money from the property. I know I'm on water. Yeah.
But the governor gives back business to the business owners.
So
Chris, you can't say we don't buy products from you daily from the fire department. It works both ways. It works both ways.
So maybe I understand all that.
And in reference to issues.
But it's still one of those things that it doesn't make money. It circulates money, but it doesn't make it. It takes money that I made and circulates it back to me. And then I circulate it back to it and circulate it back to me. That's what keeps the whole thing going. But when one end gets lopsided and it gets too heavy, the other end goes away and then there's nothing. So that's all. I'm believing. I'm not beating anybody up and I'm not attacking anybody. What I'm saying here is when we do these things, when we start mandating things on people, on business, we really need to think about, well, is there something else? We don't need 5 organizations telling business to do the same thing that one organization's already said. I have a responsibility to my employees to take care of them. I have a responsibility to my customers. By OSHA. It's my responsibility. And they're the big dog with the big lawyers that walk in and say, we're going to fine you $10,000 for not protecting them. I got nothing I can do. They're the ones that can come in with this and shut me down. Okay, and they don't really make the money. So that's all I'm saying. I want us to think, I want us to be cognizant of all the things out there that affect us. Because if we're not, we end up with 5 organizations saying the same thing. We don't need it. We want to keep one.
You know,
And it really will help y'all as a standpoint. Me, if I was a commissioner, it would help me on the standpoint, I'm protecting my businesses, yes. They still free choice in the United States. I don't want to wear it. I don't have to. Because if I have to start being kind of like sales tax, they make me responsible for issuing home. Yeah, I have no idea what it was. They fined me $30,000 2 years back, because they said I couldn't do that recently. I couldn't do that, the farm and rancher that ride along to a business. I couldn't let him have it actually. Yet I had all the paperwork and I had all the forms and everything, and said, he said he was using it for that. He said, yeah, you're the one that sold it. I never got that money back. It was almost broke. Because that comes off the bottom. And that comes out of what the profit is, the gross savings. So, all I'm asking y'all to do is y'all start thinking about farming. Is to think about every aspect of it. For somebody over there,
We've looked at all this, thought about it all weekend, it's been on my mind daily. And Governor passed the recent order, and he's trying to keep everything open, keep commerce going. The city did their order last week to require the business to wear face masks. I mean, we've been ordering face mask equipment and so forth. And I know OSHA has their authority to impose nationwide. But I also know OSHA is overwhelmed because we saw it very well during the oil field. We had water trucks selling water. The sheriff and I, we went on site where people were drinking water out of, taking bath out of frac tanks. That's the way oil companies had to make them. The sheriff went with us. People were getting sick left and right. OSHA stepped in, even though they got mandatory guidelines. Nobody took care of them, and they didn't. And I agree there has to be a balance between local government and businesses. Yes, you pay taxes, pay sales tax, all this dirt. But there's also a segment of business that's been saying, help us. I had calls from Super S people not wearing masks. It's your business. You have the right to refuse business. You have the right to run your business. Somebody doesn't behave, somebody doesn't, if you just cause problems or whatever the reason, you can say, hey, sorry, Mr. Mrs., we don't want you. And Lowe's ran into that situation this weekend to where it said, we want people to wear masks. We got too many people coming in and people don't want to listen. So there's a balance of people out there in the community that says that unless the government say, wear a mask, we're not going to listen to you. So where do you find that balance?
They weren't allowed to refuse the service at Lowe's when they didn't wear masks?
No. We had the situation with the firemen as well, where people come in, didn't want to wear a mask, they pace back and forth until we had to call the sheriff's office. I happened to be there at one time, and someone was dead set. I had to talk to the supervisor and everybody else, because they really got hot about the business saying, hey, please wear a mask. So it's finding a balance. I understand because it's hard for the people that have jobs are lucky. You have quite a bit of unemployed people. We don't know if the school's going to go open as viral, but we are sandwiched between two highly infected areas. So, I mean, we don't have to pass anything on the mask today, but because it's already done. But we got everybody to kick in. Everybody kicked in very well. We did, but they did good. But then it got opened up. People are tired. They go to the beaches. They have barbecue. Rivers. And here we go again.
The largest, the age group for highest infections right now is 20 to 29 years of age.
I think on that, Judge, on what Mr. Mars is saying is, on that OSHA deal, a lot of people don't have access, or most of the regular people don't have access or anything to read a lot of those rules, and they ask us, we went from the governor's side, and they get informed more basic information and find out what do we do, and we have parties more than 15, there's a lot of things they don't get informed through that side, and more people, businesses, they find information through there, but the regular people, they don't know exactly what to do, so they get a little bit more information from our side.
Why wouldn't you be able to share
No, you can share it, but like most people don't go into those, that know, go through OSHA, just your regular family, they get more information, what did the county, what's going on instead of going through that OSHA information, website or whatever they have, that they don't know, not everybody goes, it's a little bit simpler, I guess, what I'm trying to say.
But even as far as the OSHA standards, it's, this is nationwide, it's beyond the ability of OSHA to control. It really is. And we understand that. And masks, you're completely right. It's been said that, hey, they don't protect everybody. You have to breathe and some vapors go out. And that's why they're recommending distancing. And if you're running or exercising, it gets bigger. So, and every time you think you understand something, it changes. But if you think it is proven that when everybody complies, then the chances are that you're going to reduce it. Wash your hands, wear your mask. And we were doing really, really good. We had a fatality and an elderly person. We haven't had any children infected. And we've done pretty good at protecting their children, but you gotta have some type of pressure on the kids. You don't want them running around, and it's hard on the parents that do work, but you gotta have some curfew. Most businesses close in the evening. I think Lowe's closes at 9 or 10, after 10. We're gonna have to do something on our part to slow it down. And it may not be popular, but this is why it said before us. We don't have to put in the mask. The city already put the mask issue on there, on everybody. But it is highly recommended that everybody wear a mask. And we do have face shields. I think we have about 1,200, and they cost us about $4 each. I don't know what you sell for, Chris, or you have a stock of them. About $20 a piece? How much a piece?
About $34 a month. The question that I would have, and we really ask everybody that you run into, if we, when we run for election and whatever, we say, protect the people. I agree. We protect the people, but people really is there, and how can I think in a better way that we can put on there and everybody is for it against it, like on any other bill we pass or any other continuous law or rule that one. And I have the same problem with the governor, president, and everybody else. We got 10% of the media controls that's through the 90% population. If that's what they want, they shouldn't argue about it anywhere. But it comes back to policing again, what you said. If they do come in my store and refuse it, then I have to call the sheriff. Sheriff has to deputy. Sheriff has to remove him. Does he have enough deputies to remove everybody? Is that really a criminal offense? I guess, are we gonna enforce the rules and the laws that are really to go that far? And it should not be my job to be the police, like the sales tax. I'm right to decide whether to farm a rancher uses it on the farm or rancher takes it or whatever. It should be better. When I asked him, I said, if you're gonna give me a letter, I can write to the customer and say, the state requires me to pay this for you, so therefore you've got to reimburse me. I don't do that, please. If that's the case, then it's better for me to shut my doors, unemploy my employees, and go. And ultimately, and that's what's happening in small business. slowly but surely getting fewer. And if we don't have any place to go, what difference does it make we get the virus or not? We don't have any place to buy it, what difference is it gonna matter whether we got the virus or not? The virus ain't going away. It's not gonna vanish, it's not gonna disappear, because everybody's been exposed. I don't know what. Each and everybody, it's a virus. They say, well, we get the vaccine, they got a vaccine, every other virus. It helps. It helps those who are, my wife's a more resistant probably anyway. She's had 2 cancers. And beat them both. She's been intubated January, run 105 temperature in January. That's really low. And I'm not professing she's better or anything, but is it really?
I mean, it seems like your attitude is you're sick and again, you get it, die, what, it don't matter. I mean, because it's gonna run its course. The whole purpose of all this is to slow it down. Everybody cooperating to slow it down until they get a vaccine and try to save as many lives as they can. And the hospitals are overwhelmed. They are in Laredo. Rio County's getting there. San Antonio, they're getting out of beds. So the chances are these small communities that don't listen, don't participate because we feel it's their constitutional right to what we have an entitlement. This is on the state level. It's already been done on the state level. And we're asking to enforce. The city doesn't have the enforcement capability, but these towns that have not been doing it, they're going up. And who do you pick? Who do you pick? Daughter, your grandkid, your mom, your daughter, who's gonna get sick? If we can slow it down. I mean, my sister has cancer. I have an elderly mother. I know people with lupus and different things. And by being careless, we expose them. And that's passed on you all to take care of, and it's not hard, especially when they've already said you gotta do this and that to follow through. The city already did the mask. We've held back. They didn't say anything about the amusement machines, and I mean, it seems that everybody seems okay on the amusement machines, but they're businesses, they have people, they have families too. So it's been hard on them. And we've all been impacted. I know a lot of mothers, including daughters, that can't work because they got to watch their kids. You know, so they feel burdened. So a lot of people have been impacted. And the more we cooperate, the better it is. Because we know that the more rules you put, they break away. And we've been lucky that people have been doing so well and working together. That's what we have to continue. That's what it should be for us to work together. If you don't want a mask ordinance, then let's go ahead and space. We know what we need to do. We don't need anybody to tell us, and you're right. But you run into those people that announce that they're infected, and they go out there, they put people at risk, you know, and it's forced to take action.
I think you misconstrued his statement by saying that he said that everybody should just get it, and then if you live, you live, you die, you die. It's not at all what he was saying, for one. For two, that would mean that you're saying that in not wearing a mask is a more criminal offense than robbing somebody, because we're not gonna arrest the robbers, but we're gonna arrest you for not wearing a mask. You didn't say that, but by your tone and by your thing, I could construe that. But that's not what he was doing either. He wasn't saying if you get it, you die, so what? That's not at all what he was saying. What he was saying is for businesses, you have to look at it from the business standpoint as well, and not just the people who are wanting to put on the mask. That's why he said, have you thought about pulling it? There have been other cities that have pulled their community on whether they think there should be mask enforcement. If there is mask enforcement, should there be a fine for it? Social distancing enforcement, should there be that? If so, should there be a fine for it? I know for sure for Bryan, Texas, because I participated. So I know there's places that are doing that. So what would it hurt to do that here? So we find out that everybody wants a mask. Okay, now we know what the community wants. So we find out everybody does. The majority don't want a mask because they also feel that this virus has a 0.27% fatality rate. 0.27, not even 1% fatality rate. So, and that's in Texas. So, you know, like at some point you do have to think of your constituents, which is this community. So if you're saying I'm right, I'm not saying you're wrong, or vice versa. I'm saying listen to everybody. That's what we're here for, right?
One of the things that he mentioned said, let it run its course. Eventually, everybody will be infected. And he did say that. And this is not get back and forth, but it is going to run its course. They recommend so many people and estimate so many people are going to get it. The whole issue with communities complying is to give time for the hospitals to have enough bedding, to slow it down enough to where there's a vaccine, maybe we can save lives. You know, that's the purpose. And we understand business. I understand business. This has already been said. Even when we close today, that mass ordinance is filed by the city. It's done. But Chapter 418 of the local government code is something the governor is pushing, and this is what he's doing, and that's what the president did. They imposed the statute that override those agencies. And we heard it very well a month ago. Governor Cuomo from New York said very clearly, you know, right now, there's that epicenter, and next week it's the other states, and you know what, it's right, Texas. Texas, yesterday had over 5,000 cases in one day. And the people are dying. We had somebody die, we have another person from the elderly, from the center in the hospital. And don't know where it's gonna go. But I agree, cooperation. But we also control certain public places like the parks. People want to go walk. So you know what? All the other activities stop. And that's our duty. The governor requires us to follow that form that we're doing everything they want. And that attestation of form. So to be able to do so, we're expected to do, you know, things to protect the public, testing, and which we did. So, I mean, I understand that you feel you've lost control, and I'm sorry, but part of both the mask, and, you know, we can continue to say, hey, you know, wear the mask. But if a business implements that they don't want you without a mask, then we need to make sure that that business rights be honored.
Like you said, the city's very passive. The city's very mindful and all that. OSHA has it, the city has it, why do you?
You know, the questions I had from business owners, the questions I had were more the Maquinitas. You got out-of-town people coming, and that's what's happening with Zavala and Bennett, and the judges over there said, hey, what happens is when they close their Maquinitas, they come from San Antonio and everywhere else. And that continues. Most of your business is repeat business, your customers. When you have out-of-town people coming in because they have a gambling deal, and then we know very well that they're not paying novel pricing. They never have, otherwise they wouldn't be. The law is supposed to be a token. They can't give money, it's illegal, but they continue to beat it. You know, so it's been hard. I mean, I guarantee you're not gonna go see a bunch of stuffed animals in there when you go in with the novel prices. But I'm here to you today and say, hey, we got some rules to do. It's very simple. Just put a curfew on the kids. You know, same thing we had before, unless they're with their parent. You know, the curfew would be, they can't be out. Anybody over under 17 can't be out after 10 o'clock to 7 in the morning.
That's how it was set before.
You know. And then, as far as the Maquinita, you know,
See, Maquinitas are seat here.
huh?
Or they seat here county.
They're in the city. They're in the city. Um, they're in the city.
Don't those people know the risk of opening that risk?
I think you have people that know the risk, but many people feel that it's not gonna happen or not gonna get it.
That's their choice. That's the beauty of this.
But,
That's their choice.
but the choice is that they infect others in the community. And you run into one of those that with the maquinitas and go to your store and infect you, and you infect your child and you lose your child, you know, well, their choice, you know, hurts you. It has a domino effect. It has a domino effect. You know, it just, it has to start somewhere. And like I said, the sheriff, we hadn't done one single citation in this county. People have been good. We've had the numbers good. Now we have more active cases. We got to contain them. You know, and after we contain them, then you know we can slow it down.
The concern that I have is with the hospitals having more patients right now, they're running out of beds. Webb County, San Antonio, Frio County Hospital. If we continue upon this course of people being irresponsible, then when one of our citizens here gets sick to the point they need to go to a hospital, where do they go? And then it comes back on us to make those hard decisions here. Can't take them anywhere, or start having what we call triage. Who's more critical, and we have to take them over somebody else. I don't want to get to that point. That would be a very bad day for us. It's not that everybody's not doing a good job. There are just a few irresponsible people out there, and those irresponsible people is the ones that bring it back and spread it throughout. And those are the ones that it's hard to identify. The other problem with this virus is most people are asymptomatic. We don't know who has it and who doesn't. The other problem is if you're tested last week and you came out negative, there's nothing to say you didn't get it this week and that you're carrying it right now. So it's a very hard one. I agree that there's viruses out there, the flu every year, but this one just spreads very easily and the effects are far worse right now.
What percentage of the COVID cases are asymptomatic?
That's a very hard one to tell because if you're asymptomatic, you probably haven't been tested. So therefore, we don't know, the CDC doesn't even know how to track the asymptomatic cases.
What percentage of them have, what percentage of people that have been tested actually been hospitalized?
I would have to research those numbers. I don't have those off the top of my head. I know right now in the United States, we're at about a 12% death rate of all cases.
Out of the 10 cases in the South County, I know only one case of that. How many people have been hospitalized? Out of 10 cases?
Probably 50%.
5 of them? That 5 we have now, we're including the 5.
That was the total number of where we're at right now.
Total of where we're at right now.
So 5 out of the cases total. And it could have been a 1 day to a 5 day hospitalization, short-term lockdown.
How do we know that those hospitals are full? Is there a document they put out? Because I know that Houston one was getting told that the hospital was full, and their CEO put out an actual letter that stated that their ICU capacity was normal capacity and it wasn't totally COVID-19. oh, actually, Memorial Herman's, Texas Children's, all three of those big hospitals in Houston put out a letter that stated that they would not have capacity like it was being told. So how do we know for sure that?
So every morning, the emergency management office, we get a state situation report, and it breaks down everything going on in the state, pre-COVID, where it's going to rain and so forth. Right now during COVID, we get that in the morning. Every evening for Region 8, we get a breakdown of each county, cases under investigation or pending, active cases, recovered cases, total deaths, broken down by county, the percentage of contact spread, community spread, so forth. And then we also get at about 10 o'clock every night that day's hospital report. How many beds are available? How many ventilators are available? How many patients are just in a hospital bed? How many patients are in the ICU?
Does it break those down by COVID patients or just?
This is just for COVID.
So if a hospital has 10 beds, and they have about 5 of them recovered, then that's all they report.
No, it's a total bed capacity for the hospital, and then how many beds are available. That's one breakdown. And then it goes into how many COVID patients are in the hospital, how many COVID patients are on ventilators in the hospital, how many are in the ICU, so forth. So it's broken down probably 15 different ways.
And you're saying that Laredo, Pearson, San Antonio for all.
We don't.
Pretty-
As of last night, from the report I got, 88%. For our region, which does not include Laredo, that is a different region. We are in the San Antonio region, so we don't get updates on the Laredo or down into the valley area. That region starts McAllen area and comes up this way.
The governor last week filed an order on June 25th, and in the middle of the order it basically says, therefore I, Gregory Abbott, Governor, Texas, by virtue of the power and authority vested in me by the Constitution and laws of the state of Texas, do hereby order the following effective 11:59 p.m. on Friday, June 26, 2020. Every hospital that is licensed under Chapter 241 of the Texas Health and Safety Code and is also located in Barrett, Dallas, Harris, and Travis County shall postpone all surgeries and procedures that are not medically necessary to diagnose or to correct serious medical conditions or to preserve the life of a patient, providing timely performance of a surgery or procedure would be a serious risk, adverse medical consequences, or death as determined by the patient's physician. Provided, however, that this is a prohibition that shall not apply to any surgery or procedure that is performed according to with commonly accepted standard clinical procedure would decrease any hospital capacity needed to cope with COVID-19 disaster. And he stated that. And last week, and I'll play a very clear figure here. This is a doctor from Laredo, Sonora. Here.
Is overcapacity. We have patients in the emergency room waiting for intensive care unit beds. This is a direct reflection of opening up bars and beaches and our young people gathering in large crowds. Most of the patients that are being admitted now are extremely young, from age 18 to age 40. I encourage you over the next several weeks to stay home, to stay away from crowds. I think it's very important, and I emphasize this, very important to stay away from bars and from large gatherings. This week it's the young people Next week, it will be their parents and grandparents who they have exposed. Do not wait for the government to tell us what to do. Think for yourself. It's tragic to see these 18 to 40-year-old patients unable to breathe in the intensive care unit, and very likely many of them to be on ventilators in the next few hours. Once again, this is a crisis in our hometown. It is a flare, and I don't expect this to end anytime soon. We must be responsible, and we must be responsible the rest of this year and at least 6 months of next year until our vaccine is developed and proved to be effective. Thank you.
That's your medical doctor, Sheriff, isn't it? Oh, that's your medical doctor? Yeah.
What about the city county? Anybody heard anything on that?
No, sir.
Rumor is 50 people cut that in the battery. So, church resort.
When was that?
Church this weekend.
We'll probably get the numbers. They'll be on the report this evening, if it's true. But until then, we're kind of in the blue. Yeah.
Our order ended today, will end today, current the issues that we extended. We do a curfew, we go back to where we need to be. And we have things that have to happen. And the city already did the math. I mean, you know, what do we do with Maquinitas? We can leave them open. But Sheriff, assign us 2 people to work with Butterfield to go in and test them, make sure they're clean, because if they're not clean, then they get fined. And have those people go in, I mean, because those rules are still in place, the social distancing is still in place, and required. And with part of chapter 418 is a statute that's been passed by the legislature. And bigger cities like Bear County have gone against the governor because it would take legislative action to change it. But in cooperating with the governor, you know, we've all been trying to cooperate. You don't want to be on his bad side. But realistically, it's a statute that's on the books that gives broad powers to protect the public of every community, whether it's the city or the county. And we just try to find a balance and tailor it community by community. And I don't think we've been overpowering, but you know, I would suggest close the park only for walking. You know, if you don't want to close the Maquinitas, at least then assign a couple of deputies,
Judge,
firemen to do it.
I think we need to close them because there's seven different places they got the Maquinitas. And every day, they're all full. I mean, I see people walking in there with a mask, and they say that once they get in there, you can take it off. I mean, there's a lot of them. There's 7 of them, and they're all full in the afternoons. And most of the people from out of town, I guess.
And then the curfew for the kids from 1700 from 7 p.m. to 7 in the morning.
10 to
It's not an adult, it's a kid. They can't not be outside unsupervised without a parent, or guardian after 10 o'clock. And I believe the city already has an ordinance to that effect, that's had many years. We're just doing that.
So it's 10 till 7, right?
10 till 7. And then recommend that masks be worn. by members of the public. Also want to know if we're going to expand testing, to request additional testing. Now, we've been providing meals. Our elderly program is partly funded by the state, and it's maybe 10% of all the expenses are funded. The rest are done by the county or private donations. But during this, we've been providing meals to anybody over the age of 60 that's at home, that can't work, or they can't. Do we want to continue?
We should do it a little bit longer.
Huh?
We gotta continue a little bit longer, see how it gets
Let's
better.
continue to the month of July, because what I'm hearing from those people, and there's been a lot of people, one that they've been happy that they've been getting it. Usually a number of them don't qualify because maybe they get from the Social Security, or they get retirement, and they don't qualify for the state reimbursement, but we continue to help them, and they don't go to the grocery store as much, so they expect it. So they've been pretty happy that we continue the home delivery through the 31st.
I think we go ahead and continue delivery, just. That will be to when, July 31st?
Yes, unless we have another meeting. And the governor stated that any mass gathering more than 100 would require local government. I would say inside the city limits, except the city limits, any gathering outside city limits, then they would have to apply to the county clerk for permission.
That delivery will include, commodities?
Yes, it'd be commodities too. Will include commodities. There will be commodities for food banking. And then 8 mass gatherings, the governor threw it on us. We're outside the city, anything outside the city limits would have to apply, to the county clerk. Anything within the city limits would apply with the city secretary.
Yeah, and then commodities, can Ariana get somebody help her out, or we need to help her out? Volunteers, or we can help her out?
I think we'll continue to help her out.
So the regular home gatherings is 10 or less still. We're still gonna leave it at 10 or less.
Yes, all that remains the same.
Same.
So we'll extend the social distancing requirement to 10 or less.
10 or less. Okay.
And then we had passed an order that specifically listed based on the capacity numbers that Butterfield had done, and I haven't seen anything close to capacity of stores, so we'll just leave it alone. The only concern was is when we had the mass panic at the Family Dollar store, so we had a lot of people go in. If that happens, then we're gonna have to address it. But it seems to have calmed everything down.
Changing a lot of
Well,
groceries from one store to the other.
what happened is when they got things of toilet paper, things that they needed, everybody in town, the grapevine is, everybody rushes. So then you had a lot of people running at one time. So I don't think that's a problem. I think we're getting all the supplies that we need. Is there any other recommendations?
I think we need to stock up, Ariana, with sanitizers, disinfectant spray. Because San Antonio itself had like 800 cases just on Saturday. and all of our trucks come from San Antonio.
Commissioner, we just got a donation from, I believe it was one of the oil companies. I don't for sure know. We have 95-gallon containers of hand sanitizer. So any county department that wants it, they can come by the EOC and we'll give you 5 gallons of hand sanitizer. There is a lot of hand sanitizer on that one.
The fire department ordered a couple of misters that they can use. You know, I think they got enough sanitizer, gloves. They did get some face masks, and not as nice as the ones we have, but they're kind of like what they were. Some with a foam, just kind of bend over, and some that are like a halo that you put on top of your cap, and they ran about $4 each. We have about 1,200 of those. And the whole goal was to try to give those to the poor personnel here, because if the judges still want to enforce, get them to the people that are cooking. And you've been pretty good at getting the nursing home and working with the jail. Just to let you know.
Like on the commodities, Judge, when the truck get here, they unload all the boxes. I was getting the guy sanitizer to spray everything before we got to it. What are we gonna do now? They're still gonna just.
I mean, we could still use them. We held back because there's expense and it slowed down. But when the governor opened everything went down. But then you had a number of things. You had some holidays, you had protests, you had different things that happened, and it went back up. So, I mean, we go back and say, Carlos, come back and start spraying.
I mean, just everything came from San Antonio on the food bag truck. They unloaded everything. That guy there did it, and we just sprayed everything before we touched it. Before we got away, somebody else would use it to touch it or something.
But it's kind of holding back on the use until see what happens. I mean, for now, everything's staying open. So if you want to use them, you can get use them. I wouldn't put it as part of order. Just call him.
Sure they don't get off the
I
cars.
just call him, huh?
As long as they don't get off the cars.
No. There's some rules for them. So yeah, to extend the order that we have to include and honor what the governor's put in place. I mean, your nail salon's still open, beauty shops are still open, your hair places are still open, but they gotta follow the rules set by the governor. Your stores are still open, your restaurants have to follow those guidelines, which we put online, all those still remain open. Your hotels are open. The only thing that we didn't cover is quarantine. If we have to mandatorily quarantine somebody, Danny had got pricing of the hotels before. So we run into 3 situations. One is if an employee gets sick. You get a police officer, EMS gets sick. Well, we've been quarantining them at Fairfield,
Yes.
Fairfield until the test comes or until it passes. We've run into some situations where we have run into 2 local men. One was exposed to the virus, was tested, and his wife kicked him out. Local man, he had nowhere to go. So you can't have him go in because people, feel so sorry for him. I got to bring him in. So then you expose those people, those families. So, if you could find out from Fernando if those would qualify for cost for reimbursement from FEMA.
I believe it will because it's under the COVID response, but I will double check with him on that.
And then you run into the problem that if we do have to forcibly quarantine someone that is not listening, and it's done through whether the DA or the county attorney or the state, that we quarantine them in the hotel room. But you got some people that don't listen. So we had those calls. So just an understanding that we may have to put, because they don't belong in jail because they infect everybody else. So I just said it has to be made.
For the courthouse continues the same?
For now, we'll keep the numbers. I mean, I think your bailiff and your firemen are still doing a good job at screening everybody. And I think this next 2 weeks is gonna be very important.
I just got notified while we were standing here, we have 3 more additional cases.
You could do it?
No.
3 more? So it's up to 13?
It's gonna be 13 or 14. I'm waiting on a couple more texts.
That's 3 more actives.
And people want to know who they are, and some of the people we know because they've you know, put something out on social media. Some other people that they can't find, if they will call us and they'll ask us to go to the address, to go look at the address, and that's all we know, but they can't disclose that to the public. So in a way, it's like Russian roulette. You don't know who has it, so you gotta assume the worst and prepare for the worst. Wear your mask, wash, clean.
Stay home.
Huh?
Stay home.
Safety.
So I'm gonna ask this Commissioner's Court to consider one is leave the park walking only. I mean, if they're gonna play watches, they gotta stay apart from each other. They really have to, otherwise
So I keep that in social distance.
they gotta keep their distance. We got the curfew. Maquinitas. We'll close them. Delivery meal from 7:31. The commodities will continue. The mass gathering. And I don't know if there's anything else you recommend. Sheriff, is there anything you recommend?
I agree with everything. That's why I like to get that article last week about wearing masks. But I didn't like it myself, but we had to.
They don't leave the mask alone. The city already passed that ordinance. Is there a formal motion to just make those amendments to the current order?
I make the motion.
Second.
Motion has been made and seconded. Is there any further discussion? All those in favor, say aye.
Aye.
All those opposed, same sign. Is there a motion to adjourn?
To adjourn.
Motion has been made by Commissioner Alves to adjourn. Is there a second?
Second.
All those in favor, say aye.
Aye.
Thank you.